regarding whether or not you take your personal viewpoints on certain issues pertaining to women's health and choice into your role as the director of the Department of Health. As such, for example, something has been raised to me regarding the membership of the Family Planning Association that apparently you're no longer a member of and has been rejected. And so my question to you is this. Do you intend to bring your personal viewpoints into your job as an administrator of the Ohio Department of Health?
Chairwoman Jones, Senator, we don't have a policy or procedures based on facilities involving reproductive health. We have ambulatory surgical facility policies and procedures that are driven by the law, and we treat all ambulatory surgical facilities the same. They go through all types of ASFs, go through a rigorous regulatory, legal, and medical review process before recommendations even come to my desk. That is driven by the law and we obey the law. Like you, I took an oath in accepting this position to faithfully uphold and execute the laws of the state of Ohio. I take that oath more seriously than anything else when it comes to the Ohio Department of Health. This is not a forum for me to work out my personal values systems. It is a very important public trust, and I am empowered to implement the law. Now, if we will do that, we have done that, we will continue to do that. And if somebody would like to change the law, we will be happy to apply a different law. But with sincere respect, I would submit that you're in a position to do that tonight.
Thank you very much, Madam Chair, and thank you. I want to echo Senator Gardner's statement in regards to your efforts on all of you and your team and positions did an excellent job in that response. Thank you very much.
Thank you,
Senator Farrow, other questions? Senator Torres.
Thank you very much, Madam Chair. Mr. Hodges, thank you very much for coming in and providing some more insight into your background. One of the issues that I'm most concerned about, and I know the chair is as well, is reducing infant mortality, and my interest is broader than that, reducing unnecessary premature death and disease amongst racial, ethnic populations in the state where we're doing very, very badly. And one of the ways to address that is, certainly for infant mortality, is to reduce the number of unintended pregnancies, which gets back to reproductive health, family planning. One of the major ways to reduce infant mortality is spacing pregnancies, which is planning. And so, again, following up on Senator Cafaro's question, your thoughts, beliefs, and the role of the state health department in ensuring that we have family planning services throughout the state of Ohio so that we can reduce those infants who are dying prematurely.
Chairwoman Jones, Senator Tavares, first of all, I want to compliment your efforts and the chairwoman in the effort in the area of infant mortality. Ohio ranks 50th in U.S. black infant mortality, 44th in white infant mortality, and 46th overall. For some babies born in different parts of Ohio, they would have a better chance of survival in an underdeveloped nation. The Kasich administration and the Department of Health over the last 4 years have been, prior to my arrival, have been very aggressive about addressing this problem in cooperation with senators such as yourself. It is the top priority for the agency. I tell people that I speak to, if we could just change one problem in Ohio, pray to God it's that one. It's an embarrassment. And fortunately, work has been ongoing, and we're hopeful that we're turning the tide and beginning to see change. It won't be sufficient until we're one of the leaders in this state. There's been a lot of work going on in the area of infant mortality. ODH is partnering with the Ohio Equity Institute in 9 cities to improve overall birth outcomes and reduce the racial and ethnic disparities in infant mortality. House Bill 59 allocated $3.1 million per year in fiscal year 14 and 15 2 ODH for the Safe Sleep, Progesterone, Prematurity Prevention Quality Improvement Project, and Perinatal Smoking Cessation. 39-week project is showing signs of success. We're having an infant mortality summit in December, and all of you will be invited, and I think the RSVP list is already enormous. So it's just a sign of how seriously the state takes this. Moving forward, it's an interesting problem. We're not Idaho or Mississippi. We have some of the states, some of the world's leading teaching academic facility institutions here, some of the country's great hospitals, children's hospitals, some of the smartest people on the planet dealing with these problems. We've got thousands of very dedicated, intelligent folks dealing with this issue, yet it persists. The science is not a mystery. What works is not a mystery. I think we're all looking at service delivery, and we're all looking across the spectrum, whether it be Medicaid rebalance, patient-centered medical homes, the federally qualified health centers. This is a real passion of mine because I do firmly believe that the problem lies in service delivery and identifying at-risk populations and intervening with whatever service works and is appropriate based on science and nothing else. I think where we can make a real contribution at the Department of Health is in our informatics program. We have a tremendous amount of data that is untapped, that's not usable. I think that by investing in informatics and coordinating that data, making it available, we can pinpoint literally the neighborhoods that need help and the kinds of services that will help in those specific neighborhoods, and then we can work with our partners across the spectrum to deliver those services based on science.
Follow-up. I agree with what you just shared, but I did hear specifically roles of family planning and policies around reproductive